folks here now.
Oh, yeah, we're not there yet. Great.
Waiting room.
Joining now. We're all up.
Thanks, Miles. Hey, I appreciate everyone waiting a few minutes. Our session before this ran a couple of minutes over. So thank you for your patience. And we'll go ahead and jump right into the numbers. And I'm just sorry to report, we ended last year, 2020, on December 16th with our last briefing, and we were at 183 deaths. In just a short period of time, those deaths have jumped exponentially to 234, which is just very sad to see. Total cases are approaching now 26,500, and it's that case that the category we talked about consistently that's leading the way in this, and that's 20 to 40. Additionally, you can see, again, the Latinx, Hispanic population is taking the brunt of these cases with over 11,000, almost 12,000 cases that they have experienced. And again, the deaths by category, you can see it's certainly our seniors that are also taking the brunt of the deaths in this county. If you had told me at the beginning of this, we'd be at 234, I would be shocked, and here we are. Next slide, please. The part that continues to be disconcerting is this number right here, this 177. We have not seen it that high before, and those are confirmed cases of COVID. You can see our ICU beds are down to 4. The good news is we do have surge beds, acute surge beds and ICU surge beds, and people ask, well, how do those work? And that's if we need to go those, and those are not staffed, they're not ready to go, they would have to be staffed, but there is availability for that in the county, and that is something that certainly our partners and county health have been working on throughout this pandemic. Next slide, please. So you can see the total residents tested, over 350,000, and the total tests taken over 800,000 now, which is just remarkable. And the last slide here just shows the long-term care facility data, total cases approaching 1,000 with the deaths at 104. Okay, on to where we are with the county mobile testing numbers. The state has at the event center, I think many of you know already, has switched out Verily for Optum. We are continuing to use Verily on the mobile sites that we use. They were great partners with us, at the event center, and Optum has really stepped in and done a great job and really not missed a beat. Between Curative and Verily, last week, I think we tested over 8,500. At the event center, there was 3,300. At the mobile sites, 4,300. And in Daly City, there was the drive-through there at 858. And that is amazing. Last week, we were number 1 in the state in regard to testing. And that is just a tremendous effort by everyone involved, not only our healthcare partners, but county health and Justin Mates and everyone involved in that process. And it's amazing that where we came from to where we are now. And I'm sure that that kind of spirit will roll out also as we head to vaccinations in the county. So in regard to the blueprint for a safer economy, the regional stay-at-home order, for the Bay Area and ICU capacity. As of this morning, the state reported a 5.9 ICU capacity for the Bay Area region, obviously extremely low. And it has been a very, very difficult 3 weeks now for health around the county, around the region, around the state, who have really been battling an onslaught of these severe cases. Your hat goes off to them for battling through this through the holidays. After a long year of dealing with this, they continue to be on the front lines and at great risk, continuing to serve the public and doing just a great job. The blueprint of safer economy, just to give you an idea where we're at, the adjusted case rate per 100,000 as of 1/5 is 24.4. Now contrast that with November 9th, we were at 2.2. How things have changed so quickly in 2 months or so, 3 months. So you go to the unadjusted case rate, we're at 37.7, and on 11/9 we're at 4.1. The positivity rate 5.9, and back on 11/9 we're at 1.3. And then the health equity metric has really shot up to 11.3, and back on 11/9 was at 2.5. So we continue the testing. Again, our partners have done a great job. Optum Serve has stepped in for Verily as the state's vendor at the event center. That operation is open Tuesday through Saturday, 7 a.m. to 7 p.m. And in regard to the business engagement team, we have contacted 367 businesses, a variety of languages spoken there, and they've done a great job of outreach to them. The county has received over 1,000 complaints, 1,065, and the compliance unit has abated 72% of those, while also remaining under surveillance for many of those who were repeat offenders. The highest complaints were in the city of San Mateo, Redwood City, and South San Francisco, larger cities that would be typical. And the most common types of businesses to receive complaints were retail, shopping, and restaurants, where it was alleged that people were not wearing masks or are not socially distancing. So compliance team has issued 100 warnings, and 22 citations were issued to repeat violators. We feel that some of those mostly all of those repeat violators are now in compliance. We're not aware of any ongoing violators, and to the extent that we become aware of those, we'll take further action. Some of those were repeats that were the fine increased to a substantial amount, and that helped bring about compliance. The Great Plate program, if we want to bring that slide up, Miles, that'd be great. So it's extended through February 6th. Of course, like in the past, our commitment is to extend that to the end of the month to make sure that there is a soft landing. It has been a great program for many. 3,600 participants, over 1.3 million meals served. That is amazing. 75 active restaurants. I think there's actually 2 less now, with a couple going out of business, and $35 million that has been utilized there. The county, remember, is only pays 6% of that, and the rest comes from the state and federal government. All that money, though, when you think about it, comes back into the economy with restaurants being open, and this is really a lifeline for many of those and their employers who are getting paid salaries and staying at work. And it's just been a win-win program, and so much effort has gone into it by so many. Just so appreciative, and appreciative that it will go through February. Our hope is really that it will continue through the entire pandemic. The mobile mask group of community affairs have distributed over 18,000 masks now, and they're continuing to be out there. On the vaccination front, I think I've had a lot of questions about, what are we doing there, and what's the county role there? And in short, and Sarita can certainly jump in and help answer this if there's questions about it. In short, really, there is roles set out by the state, and the distribution has gone to the county for a county allotment, and to PAMP and Kaiser and all the other providers that provide in this county. They have received their share. So it's not, the county at this point in time is not taking the lead and coordinating for the entire county. We will handle our population at this point in time. To the extent that there are collaborations in the future, that would be terrific, and I think wise. But as it is now, those providers will provide for their healthcare workers and their clients. who are signed up to those health plans. The county is responsible for those without insurance, those that are maybe homeless, those who might be receiving Medi-Cal. We have a population that we are aware of, and our team is planning to address the needs of those individuals. It's very important for us to get out in front of that, because those are a lot of those are the folks that that are getting sick here, and we're trying to get that vaccination out as quickly as possible to as many of them as possible. And it's a matter of balancing the need against the production and that what we receive, and in our weekly shipments. So a lot more to come on that in the future, but that is where we're at right now. And I think that health has done a great job in getting the allotment out that they've received. And someday we hope to really be able to report out the entire county on what has been received, what has been distributed into arms. And that's going to take some more coordination. The state's not there yet with that, but we will get there at some point in time. So with that, I bid you all a happy new year. And let's see if there's any questions, Miles.
We have no questions in the chat, but if anyone would like to ask a question, if you just want to use the raise hand feature and we can call on you. Henrietta, if you want to unmute yourself.
Happy New Year, Henrietta.
Happy New Year. Thank you so much. First, could you talk about the process for the rollout of the vaccines? You mentioned the homeless being a priority, and who else were the other groups?
Well, really, the state has set the tier system, and we're still in the first tier, really, trying to vaccinate those that are on the front lines. And I think that tier system is out there by the state. It really lays out who those individuals are in the tier right now. We're still working our way through that tier. I think, Sarija, correct me if I'm wrong, I think we got like 36,000 frontline health workers in the county, and another 12,000 people that would be in that tier potentially in the congregate care homes. So we've got 50,000 people up front that need that vaccine. Remember, they need 2 doses with the 2 providers we have right now. So we need 100,000 doses in this county just to take care of that group right there. So Sarija, I don't know if you have more to add there.
Yeah, so and just to make sure, because I think the words tier and phases and all of that gets a little bit confusing. And so Henrietta, for your direct question, the federal government, there's a committee, ACIP, and then the State Department of Public Health are responsible for prioritizing the populations eligible at each phase. And we are in what's called phase 1A, which includes 2 categories of residents of San Mateo County, about 38,000 healthcare workers. And these are workers who have direct exposure to patients. They're not workers who are working remotely and providing, teleconsultation. They're in direct exposure with patients, and that could be a clinical role. It could be an aide who is lifting a patient in and out of a bed. It could be a custodial team member who is making sure there's a clean and safe environment. There are about 38,000 healthcare workers in San Mateo County. And then the other key priority 1A population are residents of long-term care facilities. They're in a congregate setting as their residents. And there are about 12,000 of those residents. And for those 50,000 eligible in the first phase of vaccine rollout, the county is coordinating and distributing some vaccine. The very first weeks, we were receiving vaccine, storing it appropriately, and getting it to the 6 major hospitals in San Mateo County. Because all of the major hospitals, aside from the county hospital, are part of larger systems, and they qualify as multi-county entities, they then began receiving direct supplies of vaccine from the state. And they have responsibilities for vaccinating their workers, part of those 38,000, as well as if they're connected to a skilled nursing facility. There are two pathways other than the county pathway that I just want to make sure are clear, with which Mike touched on. Number one, for residents of long-term care facilities, the major vaccination pathway is a federal pharmacy partnership, a CDC pharmacy partnership, and it includes Walgreens and CVS, trying to reach as many of those 12,000 residents and staff of long-term care facilities as possible. And then there is this pathway that's directly from the state to what's called these multi-county entities. That's like Kaiser, which has 2 hospitals and major medical presence in San Mateo County, Sutter. And then the county's responsibility, in addition to the coordination and assurance functions, are for the populations that aren't directly in the sphere of the multi-county entities or the federal long-term care partnership.
So, Srija, just as a follow-up, there has been some talk because of a new strain of the COVID virus that instead of giving the vaccinations in 2 different shots, of giving it in one, that it would reach far more people. Is there any discussion about that at the county level or the state level that you know of?
There's really discussion in the scientific community and certainly at the federal level around what is the science in terms of the dosage strategy. And I don't know all of the details of the clinical trials used in each of the Pfizer and Moderna vaccines. Those are the vaccines that are approved for use, as to how much science there is for the efficacy with 1 dose. That's what's being talked about. Those are typically not county level discussions. We are following the scientific guidance of the federal and state bodies that parse that science and give direction.
One more question, if I can, for Mike. You had mentioned Verity giving the testing, and I think that you said at the event center, is there another vendor that was being used?
So yeah, so Verily was at the event center. Now it's Optum that has taken over. That was the state contract. The state switched Verily out for Optum. We are still using Verily on our mobile testing sites after a long partnership with them at the event center.
Why was there switch?
I have no idea. That was a state operation. That would be a great question for the state.
Thank you.
And I just also would like to follow up and just say, for those that the county is responsible, that Srija touched on, we are working as quickly and diligently as possible to make sure that when that time comes, they will get their vaccines. And it's important. These are some of our most vulnerable individuals in this community, and we understand that time is not on our side here, and we want to roll those out as quickly as possible. So that is something that we are laser focused on, and really we'll have more information on how that will be rolled out in the future.
Thank you.
Great. And we have a 2-part written question from Sierra. The first part relates to the phasing of vaccinations. So how far is the county into phase 1A, and when does it plan to shift to phase 1B? And what will phase 1B look like in the county, and how many doses do we expect to complete that phase, with a follow-on of how likely is it that the county will reach broad vaccination of the general public by summer as previously projected?
Sri, do you want to take that?
Sure. I'm trying to read what Sierra typed as well. So, we're basically 3.5 weeks into phase 1A, and our best estimate right now for the county's 50,000 eligible phase 1A residents to be completed with the 2 doses is through February. That's our best guess right now. Not best guess, that's thinking right now. There is a 3-week time frame for the between the first and second dose of the Pfizer vaccine, and a 4-week time frame between the first and second dose of the Moderna vaccine. We have received the 22,000 doses, and I believe there are 6,000 that we expect to receive in a next allotment. And we're learning each couple days how many doses we will be receiving based on the overall supply chain that goes through the state. And then the state allocates to multi-county entities, and to local health departments. In terms of the general public and when we might reach the general public, it is very difficult to estimate that right now. A lot of it will depend on both the supply issue and how much that increased supply can be flowing as expected. And then the second has to do with the capacity of the major healthcare entities, the Kaisers, the PAMPs, the Sutters, the Dignities. It is, you know, there's a big challenge that they're handling right now with the current surge, and the personnel, you know, available to do that critical job is super important. And so there are decisions the healthcare systems are making to not deplete their personnel if they happen to be some side effects with vaccinating, or anyone needed to take some time off, you know, because of their schedule, what their role as a vaccinator, their role on the front lines. So there's just a lot of complexity to work through to get to good estimates of when we'll reach the general public. Our federal leaders continue to express optimism that, you know, by the end of summer, we hope to get a lot of the way there. And we'll keep revising our timelines and projections as these factors, you know, settle out.
Sarah, additionally, there won't be clear phases where like you complete phase 1A and you know, then you start, there'll be some overlap of the different phases, no doubt, as we move forward through this.
We are needing, and the state will need to finalize guidelines for the 1B group before that can begin. Everyone would need that finalized guideline to be issued.
Yeah.
Here's one more piece from Sierra here, which was the county was expected to receive upwards of 36,000 vaccine doses by the end of 2020, but only 22,000 were received. Do you know why the county has received fewer than projected? And did the original estimate include some sent to private care facilities?
Well, the state is definitely balancing how much should be distributed to the multi-county entities and how much should go to the local health departments for the responsibilities that don't fall into the multi-county entity purview. And then also understanding the timing and the rollout of this long-term care partnership, given the critical priority of reaching those residents. So I don't know the specifics. I don't remember the 36,000 dose estimate and when that was relayed or what all that was based on. Numbers are getting adjusted fairly frequently, you know, because of these different factors.
One last call for questions here. So if you do have a question, you can use the raise hand feature in Zoom or submit it. Seeing none, I think we can close it out, sir.
Great, thank you all. I just really appreciate it. Really take care of yourself. This is a very, very risky time. So let's start off the new year the right way and stay healthy. Take care. We'll see you in 2 weeks.
Thank you.